Now that you understand the basics about the SHAPE program, let's dig a bit deeper to help you understand why SHAPE is more than just a diet by sharing the healing philosophy behind the development of our product. All of the ingredients in our formula were chosen to support this philosophy, formulated out of decades of clinical experience by Dr. Todd Frisch. When a healthcare professional looks back at his or her career, they realize they saw patterns or similarities with many of the patients who sought their care. As Dr. Todd began working with patients and developing his own protocols, he realized patients got sick in many of the same repeating patterns. This helped to create a theory he refers to as his dis-ease model. He describes dis-ease as a disharmony or a lack of ease. Those in restorative medicine are comfortable with this term. This is not disease, it's dis-ease. We assume every patient was once vibrantly healthy. It is everyone's greatest desire to live a long and healthy life, understanding full well we will all eventually succumb to death. Every patient will fall somewhere along this spectrum. Our job is to do everything humanly possible to help you remain healthy or regain your health. Doctor means teacher. Our role is to help you understand what it takes to sustain vibrant health for as many years as God grants you life. So let's begin. There are basically 3 phases you will travel on your journey from being vibrantly healthy to being sick and heading toward death. With Dr. Todd's strong background in traditional Chinese medicine, or TCM, he calls the first phase the Qi phase. Qi means life force or life energy. There are no significant or major symptoms in this phase. However, you will typically report feeling off. You simply don't feel as great as you used to, and often don't seek professional help at this point. The second phase is the water phase. In this phase, you'll have symptoms, but no real known medical cause. 2/3 to 3/4 of patients seeking help fall into this phase. The third phase is referred to as the blood phase. In this phase, the medical tests, blood, X-ray, CT, MRI, etc., will begin to show abnormalities. Medicine will begin to label you sick or well based on the findings of these tests. This is where Dr. Todd believes the weakness begins with Western or allopathic medicine. You must basically be 2/3 sick before they recognize a problem. This is not a slam against medicine, it's simply an observation. You know you're sick, your doctor knows you're sick, and yet the tests show you to be textbook midline normal. Who is out there to help but healthcare professionals who think outside the box? We believe the best doctor in the room is not us. It is the doctor inside each patient. Oftentimes, we, the practitioner, simply need to listen to you, our patient. Often, you will tell us what is wrong if we'll simply be open to hearing the voice of your innate doctor. Our job is to find the missing link and help you resolve the problem. We must develop diagnostic skills to evaluate our patients in the Qi and water phase. It is very important to realize that once you cross this 2/3 line, the hyphen disappears and dis-ease becomes disease. At this point, you must be treated medically. This is where Western or allopathic medicine shines. The problem is medicine has no parameter to assess until you cross this critical line. They're typically not trained to help you stay healthy. We in restorative medicine have much to offer and can provide tremendous support while you're undergoing medical care. As an example, acupuncture while undergoing chemotherapy, nutrition or herbal support, nanomolecular medicine, detox programs, exercise, counseling, etc. Sometimes the greatest support we can give is validity to our patients. Medicine doesn't put much emphasis on supporting the weakened immune system. This is where restorative medicine shines. We believe the body is only as healthy as its weakest link. We must do everything we know to support and strengthen any area of weakness. We must respect what medicine is doing, and we believe that much more can be done to support you and your ability to heal. Once you cross this imaginary line, we do not recommend treating you without a medical doctor being involved. Now let's take a deeper look. Now you're beyond feeling off, and you're experiencing nagging symptoms manifesting into what we refer to as the water phase, because you have too much water causing expansion or not enough causing contraction. We use the term water figuratively. It has nothing to do with edema or dryness, although these are symptoms that can occur. This verbiage came out of Dr. Todd's years of studying the macrobiotic diet. Expansion is yin and contraction is yang. These terms might be confusing if you've not devoted a significant amount of time studying traditional Chinese medicine. Symptoms can be either categorized as expansive or contractive. When we refer to muscles, spasm is obviously contractive, whereas a muscle laxity or weakness is considered expansive. As you can see, we've listed a sampling of symptoms, but the list could be quite vast. It is important to note that you don't have to be one-sided. Here's an example. You can have damp or wet heat or hot syndrome in your body that could manifest itself in asthma, vaginitis, or athlete's foot. And you can have symptoms on both sides simultaneously. Another example would be the bipolar manic depressive patient where the pendulum swings between depression and anxiety. When you understand this philosophy, you may experience an aha moment. This could be the first time you feel validated and believe your practitioner understands your struggle. So now we have symptoms that are expansive or contractive, as well as many things that influence expansion and contraction. You will see items listed under each category. Things that are on the expansive side tend to make you fat or dizzy, whereas things on the contracting side tend to shrink or dry the patient. When you consume one side, there is a natural tendency to crave the opposite side in order to create balance. Your body will constantly strive to maintain balance or homeostasis. When you eat something salty, you tend to crave something sweet. That is why the popcorn and soda taste so good together, and why theaters douse their popcorn with an excessive amount of salt, knowing full well that the patron will need the big gulp to complement the duo. The same premise applies to the cigarette and coffee. This is why bars serve salted peanuts or pretzels, hoping their customers will consume more alcohol. To take it a step further, that is why drugs are given for depression. It can absolutely balance the body, but these drugs will never heal the patient. When we consume one side, the body will crave the opposite to create balance. The pendulum is constantly swinging back and forth in an effort to create balance. So what's the point of all this? The point is everything we do as healthcare professionals should be focused on creating balance. Regardless of who you choose as your shape practitioner, each will make an effort to help you obtain and remain balanced. Our desire is to help you heal.